Aminoglycosides. They include streptomycin, gentamicin, tobramycin, amikacin, kanamycin. Common properties of aminoglycosides. They contain two or more amino sugar attached by glycosidic linkage to hexose ring. They are highly polar compound, hence poorly absorbed from the GIT. They are administered by parenteral route for systemic effect. They are mainly distributed into extracellular fluid and poorly penetrate into the CSF. They are not metabolized in the body. They have bactericidal action against gram-negative aerobes and are more active at alkaline pH. They causes ototoxicity and nephrotoxicity. They exhibit partial cross-resistance among them. Transport of aminoglycoside into the bacterial cell requires oxygen. Hence, anaerobes are resistant to aminoglycosides. Mechanism of action. Aminoglycosides are bactericidal agent, inhibit protein synthesis. Entry of aminoglycosides into bacterial cell. Binds to 30S ribosomal subunit, inhibit initiation of protein synthesis, cause misreading of codon. Premature termination of protein synthesis, insertion of wrong amino acid into the growing peptide chains, formation of defective protein, incorporation of defective proteins into bacterial cell membrane, altered permeability and disruption of cell membrane. Mechanism of bacterial resistance. Bacterial resistance to aminoglycosides is due to inactivation of the drug by bacterial enzyme, decrease entry of drug into the bacterial cell, and decrease affinity of the drug for the ribosomes. Aminoglycosides exhibit a concentration-dependent killing effect. Higher the plasma concentration, more of the bacteria is killed rapidly. A post-antibiotic effect. Bactericidal effect is present even when serum concentration falls below MIC. Therefore, once daily dosing regimen is effective. Dosing. Once daily dosing regimen, total daily dose is given as a single injection. It is preferred because it is as effective as multiple dose regimen. Higher peak plasma concentration is achieved following single dose. Is suffer than multiple dose regimen. The plasma through concentration of aminoglycosides remains below threshold level for toxicity for a long period of time is convenient. Multiple daily dosing regimen. The total daily dose is administered in 2 or 3 equality divided doses. Adverse effect. Ototoxicity. The important risk factor for ototoxicity are elderly patient, repeated courses of aminoglycoside, persistent increased concentration of the drug in plasma, patient with pre-existing auditory impairment. Nephrotoxicity, neuromuscular blocking effect, hypersensitivity reaction are rare. Use of aminoglycosides during pregnancy may cause ototoxicity in fetus. Streptomycin uses. Streptomycin is one of the first-line drugs for tuberculosis and is used in combination with other antitubercular drugs. Gentamicin. It is the most commonly used aminoglycosides antibiotic for aerobic gram-negative bacillary infection due to E. coli and Proteus. It is also effective against gram-positive infections. Neomycin. It is a highly nephrotoxic, hence never used for systemic effect. It is used only for local effect. Soframycin. Soframycin is also highly nephrotoxic, hence not used for systemic administration. Amikacin. It has the broadest spectrum of activity. It is resistant to aminoglycosides inactivating enzyme. Tobramycin. All features are similar to gentamicin. It is superior to gentamicin. Paromomycin. It can be used in intestinal amoebiasis, vaginal trichomoniasis, hepatic encephalopathy. Natilmycin. It is resistant to aminoglycoside inactivating enzyme, hence effective against most of the gentamicin bacteria. Therapeutic uses of gentamicin and other aminoglycosides. Among aminoglycosides, gentamicin is the most commonly used because it is cheap and effective against most of the aerobic gram-negative bacilli. Severe aerobic gram-negative bacillary infections, urinary tract infections, pneumonia, infected burns, meningitis, osteomyelitis, septicemia, peritonitis. Gentamicin, tobramycin, amikacin, and natilcimine are effective against P. aeruginosa. Amikacin and natilcimine are used for treatment of serious nosocomial infection due to gram-negative bacilli. Bacterial endocarditis due to S. viridans. Tuberculosis, streptomycin, kanamycin, and amikacin used in the treatment of tuberculosis. Other gram-negative infections, plaque, brucellosis, tuberemia.